to hear some great news. We are pleased to announce that we are engaging in a new partnership with J&J Vision to support diversity, equity, and inclusion activities within the schools and colleges of optometry. So ASCO, as an organization, many years ago started a program to support increasing the applicant pool to address the lower numbers. Our aim was to increase the applicant pool with robustness, a diverse group, so that we could improve the profession as we go forward. That was in about 2019, although we've been having diversity programs within the association since well over 2005. It's one of our core values, and it's involved in all the activities that we currently do. It's in our current strategic plan and will continue to go forward. With over 1,300 volunteers, 18 SIGs, and 12 committees, we represent the schools and colleges and the faculty, staff, and students. Our goal, of course, is to have a diverse and qualified group of optometrists to take care of patients across the country. So, we are pleased to announce this unique partnership, which is the largest in ASCO's history. This sponsorship will allow us to improve on our cultural competency within our faculty, staff, and students, to grow our applicant pool, and to really make a difference in optometry. We are so honored to work with you. This, again, is the largest sponsorship that we have received, and we can't wait to continue to partner as we move forward. I'm going to turn it over to you to say a few words.
Well, thank you very much, Dr. Nichols. When I was in kindergarten, I had a friend, and she had an older brother who used to make fun of me all the time. He used to make fun of my height. He called me all kinds of names, but one day he told her, "You can't be friends with Carissa because she's short." And I was flabbergasted. I mean, at 5, I was like, really? I mean, it was a learning lesson for me, because until then I didn't realize that there were differences between people, between our friends. And what I took there, I understood not only are there differences, but people can judge you based on those. Sometimes you can't even change, how, I could not change how tall I was at 5. I can't change it now either, but yes, I do have shoes, sometimes they help a little bit. But what I realized then, or what I realize now, is that people have biases. We can't change that, and many times they're unconscious. But what we can change is embracing the differences that we have, because until we do that, we will not be able to propel ourselves forward. And by embracing and celebrating these differences, that's how we collectively can become more powerful. So diversity, representation, equity, inclusion, these are all near and dear to me, as well as the profession of optometry. So it is, I am filled with joy when we think about the partnership that we have with ASCO. And ASCO represents the future of our profession. So it's how we will serve our patients and our diverse communities moving forward through these new doctors. And when I think about what we can do together, I get really excited, Dr. Nichols. So at Johnson & Johnson Vision, we are always excited about innovation. We're excited about the new news that we're bringing with groundbreaking AccuView products. But when I think about what we are doing, it absolutely fills me with pride when I think about the impact that we are making in our communities that we serve by supporting important social initiatives like this. And at Johnson & Johnson, diversity, equity, and inclusion, it's always been part of who we are as a company. But last year we made an outward commitment to support more representation of people of color within optometry, to bring more diversity and equity to the eye care industry, and to create more culturally relevant material to serve our patients and doctors in our communities. So we have a lot of work yet to do. But this is the beginning. and you at ASCO have already done a significant amount of work already, but collectively, when we embrace these differences, we can ultimately serve more patients better, and I am really excited about the initiative that we're starting. Thank you.
So first of all, thank you for being here. I feel very privileged standing here next to my partners and working on something that's really close to our heart. This is about making a difference for patients and doctors and whoever needs healthcare, specifically eye health. And so it's a privilege, and I'm really proud that we were able to do that. So thank you for giving us that opportunity. Driving that D&I discussion is something that sits in the DNA of Johnson & Johnson. And if you look at our credo and what we stand for, it talks about the doctors and the patients, and also talks about community. And again, just echoing what Dr. Lee was saying, that's what we truly want to do. And so J&J decided a couple of years ago already to embark on this journey to make sure we change the trajectory of health for humanity. And as Johnson & Johnson vision, that's how we do that. That's how we walk that talk. That's through collaboration, finding ways to make a difference. So I'm really, really happy we can do that. And lastly, I think it's also an opportunity to show how we can inspire people. I mean, can we inspire people by creating those opportunities for them to make a difference? And so eye health is a high unmet need, and it's a great way to make a difference for patients and eyes and wherever you are. So thank you again for having that opportunity for us to work with you, and I'm really looking forward to seeing the impact we have. Thank you.